You'll find links to the Neighborhood Housing Services of Silicon Valley and the Fair Housing Law Project and other helpful resources on our website, kteh.org. Now, housing is a very important indicator in measuring the state of the valley, but equally important is the quality, affordability, and accessibility of health care. According to the Silicon Valley Index, most people in the valley have some kind of health insurance. Most of that coverage is provided by employers. But as insurance costs rise, some small businesses find it hard to maintain that benefit. Oanh has the story of one small businessman who had to make a difficult choice.
Miguel Espana has dreamt of running his own business since he was a teenager sweeping floors in an auto body shop. He's now living his dream as owner of this shop. His proudest moment came 5 years ago when he bought health insurance for his 10 workers.
As a businessman or business person, I mean, that's one of the things that we like for our employees to be able to have insurance, benefits.
That changed last year.
We get our invoice and we get our insurance agent as well, where he informed me that the rates, they're going to go up dramatically. So then, we run the numbers and I say, wow.
To maintain health insurance for his employees, Espana faced paying over 20% more, but the shop's revenues weren't growing by even half that.
I discussed it with my accountant and says, you have to make a decision. So either might be able to maintain 8 employees, 7 employees, and keep the health insurance, or keep all the employees and just let the health insurance go for a while. So that's what we've done.
Small businesses are facing tough decisions as the cost of health care rises. In Santa Clara County, the majority of the uninsured are working. That's almost 90,000 people, and that population is growing.
People often assume that the uninsured are all poor, but more of late, a lot of employers are struggling with the high cost of health care and are in fact dropping health insurance coverage. So the nature of who's uninsured is changing.
Those without insurance in the valley are likely to be minorities. Residents who speak Spanish and Vietnamese at home continue to lose health insurance while coverage rates for English speakers remain steady.
The last time I went to the doctor, I actually had insurance. That was like 5 or 6 years ago, and I just been rolling the dice basically, and nothing's happened yet. But when it does, it's, somebody's got to pay. It's probably me.
Many workers and their families can't afford coverage on their own, but they earn too much to qualify for government programs.
It's a pretty empty feeling knowing that it could finish whatever you have going for you as far as getting sick or something. It could change your whole style, your whole lifestyle. You'd have to find a way to pay for it, even taking money out of your house, equity money, whatever.
When uninsured workers like Araujo get sick, they often end up walking through these doors.
They aren't immunized, they aren't getting preventative treatment, they don't go to a doctor until something becomes apparent that it's wrong. And what hospitals do is they charge everybody else a little extra to make up for that person that they had to care for free.
Valley Medical Center is partnering with local groups to offer health insurance for the working uninsured.
Our idea is to really use the best of the social safety net, the public sector. Here in this county, we have Valley Medical Center and clinics. So to be able to leverage that system in partnership with employment-based health care coverage.
The group will launch an insurance program called Healthy Workers later this year. Valley Medical will offer services at reduced rates, and employers like Miguel Espana and his workers will share the premium cost.
A typical family might be someone who is working in a company that has less than 50 employees, that's making anywhere from $30,000 to $40,000 a year.
The program aims to enroll 25,000 workers. The cost to small businesses for each enrolled worker, about $1 an hour.
According to the Silicon Valley Index, about 9% of Silicon Valley residents have no health insurance of any kind. The good news is there are a number of programs that are designed to provide care for children and fill coverage gaps for seniors. Here to fill us in on these programs is Dr. Marty Fenstersheib of the Santa Clara County Public Health Department. Thanks for being with us.
My pleasure.
As the man who runs the department, well, you can give us the pulse. What is the state of the health of the Silicon Valley?
Well, the nice thing is we are a very healthy community. If you compare us as a county or a valley to the rest of the state of California, we look really good on the surface. My concern is when you start scratching the surface and start looking at the numbers, you start looking at some major disparities in health. So for instance, health coverage. You mentioned 9%. It's actually probably around 11 or 12% of people that are not insured. But when you look at Hispanics, it's 1 in 3 that are not insured. So again, a lot of disparity issues. Otherwise, heart disease, lung disease, in comparison to the rest of the state, is looking pretty darn good.
Why do you think better than the rest of the state?
We're a very wealthy area. We have great medical providers in our community, pretty much a very healthy job market. So the access to care is pretty good. But again, there's still some of those disparity issues in some of the important areas of our community and some of the populations and ethnic groups that really don't have quite the access to care.
So you can't believe just the numbers. You do need to scratch below the surface a little bit.
Absolutely.
Now, that story we just watched talked about the Healthy Workers Program, which helps workers, but seniors and children are areas where there are sometimes gaps. We have programs for those as well.
We do. There's a lot of different programs. For seniors, for instance, I mean, seniors for the most part, Medicare, Medi-Cal are pretty well covered. There's still some seniors that don't have coverage. Remember that the health care system in this community is very diversified. There's the Valley Medical Center, the health and hospital system, where the public health department is, provides coverage no matter what your level of insurance or non-insurance is. So if you don't have anything, you can still go to the health and hospital system at Valley Medical Center. Seniors, for instance, can't have a lot of problems maneuvering through some of the prescription drug programs, for instance. And so even though they have coverage, sometimes they don't understand it, and they have a lot of potential choices for that. So again, coming into some of these programs, such as the Council on Aging, the Healthy Aging program at the Health Trust, for instance, or at the Valley Medical Center, we have staff that actually will help some of those seniors maneuver through some of those problems.
We're hearing now of a looming state budget crisis that invariably trickles down to the counties. Are you worried about reimbursements and cuts that will come here to the Silicon Valley?
We really are. Again, the county hospital is required to provide care to everyone, no matter what level of health insurance that you have or you don't have, or whether you're employed or you're not. Reimbursement rates now are being cut at the state level, and that's going to certainly impact the county. We're also concerned with a lot of the other public health programs that look like they're going to be cut across the board. The governor has set a 10% increase. And for programs such as tuberculosis, where we have a major problem in this county with TB, which most people don't know, that may mean cuts in staffing for our programs in public health.
You know, we can't turn on a presidential debate without hearing universal health care, and that is emerged as never before. Can you share your thoughts about that, and is that the approach that ultimately will make the difference for the most amount of people?
Yes, there's no question that in a country like ours, we need access to health care for everyone, and universal coverage, no matter how it comes, is going to be the answer. It's just been very difficult. We had that opportunity in the state recently through the legislature that kind of fizzled out, and it didn't happen. The presidential candidates are always talking about universal health care. We have to get there because, again, we have got to be able to provide for care for all of our communities, and that's going to be very, very important in the future.
The public hospitals are so overburdened because, of course, we are all paying for those who don't have insurance when they come to a public facility. There's also the question, though, of people who work and they are subsidizing their own insurance, perhaps through a premium, and it seems as though the deductibles are getting higher and what is covered is getting more and more limited. So even if you're insured, you may not be insured the way you were in the past.
a lot of people are underinsured, so that terminology. So they may have some coverage, but it may be for some major medical event, whereas for regular types of checkups, those things are not covered. And the problem is if you don't get regular care and you don't have a medical home, you end up going to high-cost centers like emergency departments to get your general care, which again is usually late in the game, and you're too sick really to not have to go to an emergency room. When you end up there, the costs are very high for your treatment. So it's better to start off in prevention. Again, public health prevention, an ounce of prevention is worth a pound of cure is still a good saying.
Yes.
Again, do things to prevent these issues from happening in the first place and getting good medical care from the start.
Absolutely. Thank you, Dr. Fenstersheib, head of the Santa Clara County Health Department, for your insights.